I was recently at the second annual UCB Hidradenitis Suppurativa or HS Summit, and I couldn't be more excited after leaving. The first year I got energized, this year even more. They bring together HS experts and patient advocates who are out there spreading awareness. And when we collaborate, it's so exciting because the doctors get an even more in-depth look at what patients are going through and experiencing and the challenges they're facing. And then the patients get to learn from the experts to make sure that the information they're posting online is accurate. So, a few key takeaways that I think can help you in your practice are number one, listen to your patients. Even though we unfortunately hear of very similar HS stories of misdiagnosis and this terrible journey, it's really important for you to listen to the patient because they haven't been heard by all those providers who didn't help them out. So it's important to listen and to make sure that they're being heard and really ask about their symptoms, ask about what's important to them. What do you want to do in your life when your HS is under control, or what are you not doing right now because of your HS? By the same token, a lot of times patients have been told that it's caused by obesity, caused by smoking. So I don't bring that up on the first visit. Build a nice trusting relationship. And then once the patient knows that you're really there for them, you're not going to give up on them, you're going to get their disease under control no matter what it takes, you can mention things about smoking cessation or maybe some exercise routines. But it's not a good way to start the relationship because a lot of times they've had a lot of shame and stigma from those things. The other thing that really applies to us practicing dermatologists is we are waiting too long to treat HS. We have some good data now that shows the longer you wait before starting a biologic, the less likely a patient is to respond because of that progressive tissue damage and tunnel formation that actually makes the disease more difficult to treat because it's surrounded by so much inflammation. So I would say just about every patient who walks in your office with HS is probably a candidate for a biologic, and you should be thinking that way. The only HS patients who aren't candidates are those that have mild intermittent disease that's well controlled with something else. Everyone else, you should be thinking about it. The other piece is that in HS, we often have to combine things to build an effective regimen. It's not like psoriasis where I just put someone on a biologic, their skin totally clears up. They may need to be on other things in addition to their biologic, like spironolactone, metformin, finasteride, maybe some on and off courses of antibiotics. And so that's an important thing to consider, that right now you don't need to rely on the biologic to do all the work and help them out. Often they will need some surgical procedures too. So if the inflammation looks really controlled, but they still have persistent lesions, those need a little de-roofing or cryoinsufflation or some in-office procedure, or maybe a bigger surgical procedure if it's a bigger area. But combining those therapies really helps you to get to that therapeutic target and get disease under control so patients can live their life and not worry about their HS.